Good morning, everyone. We have already formed a quorum. I declare the meeting of the Subcommittee on Resolution of the Board of Directors of the Leung Kuk to order. First thing to do is to elect a chairman under the rules of procedure. So, any nominations? Elizabeth Quat. So, you're nominating Mr. Ma Fong Kwok. Mr. Ma, do you accept the nomination? Yes. I need a seconder. Okay, so I'll second. Any other nominations? No. So, Mr. Ma, you are elected ipso facto. So, Mr. Ma, please take over the chairmanship. First, let's invite the administration team to join us. Welcome to all of you. First, let me introduce the officials and our guests. From the administration, we have Ms. Victoria Chair, Assistant Director of Home Affairs, Ms. Queenie Wu, Government Counsel from the DFJ, Dr. Joanna So, Senior Medical and Health Officer from the DF Health, and Mr. Kwok Chi Leung, Assistant Director from the SWD, and from the Leung Kuk, we have Dr. Eric Chang, Chairman, and Mr. James Chen, Chief Executive Officer, and also Mrs. Bridget Yu, Principal Social Services Secretary. All right, over to the administration. Please walk us through the relevant papers. Thank you. Who is going to do that? Yes, thank you, Chairman. First of all, let me briefly go through the resolution. Since 1878, the Leung Kuk has been providing services and healthcare services to the community of Hong Kong. With an aging population, the demand for medical and healthcare services have been rising. That's why the board of the Leung Kuk has proposed this resolution in order to amend the schedule of the Leung Kuk Ordinance in order to enable it to provide, that is, to keep, maintain, and provide all kinds of medical and health services to the community of Hong Kong. What we'd like to say is that the purpose of the resolution is to expand the scope of services provided by PLK in order to meet the needs of the community. But then, before providing any health and medical services to the general public, Leung Kuk will have to comply with all relevant legislation in Hong Kong, and Leung Kuk has also promised that all the services will be self-sufficient and it will not be seeking additional funding from the administration as a result of the provision of additional services, and it will also not be using the existing funding to cross-subsidize the new services. And PLK has also undertaken that existing services will not be affected in any way, and I'll defer to the CEO of Leung Kuk, who would walk us through the new services. Yes, Leung Kuk has also been providing existing users with medical and health services, and we also have residential care services for children. We have a children's healthcare center, and then we also have residential care centers for our aging population, and there are also regular checks and inspection by doctors, and also in 2 of the self-sufficient units for elders and disabled persons, we provide Chinese medicine and dental services. And in 2012, the board also agreed that in Prince Edward, we would like to set up an integrated health center, and that would also serve our social service users, and talks and also health assessment and physiotherapy services will be provided, and that's also funded by us. And we have also got supplementary provision from the board in order to fund such services, and these services have been well received by our service users, and an aging population is going to be a major challenge for the Hong Kong community. And then for elders, they also have an acute need for health and medical services. That's why we are proposing this amendment, so that Leung Kuk will be able to provide more medical and health services to the wider community of Hong Kong. That's our hope. And we have also ensure that our service targets would be the disadvantaged groups and also the grassroots. That's why in developing our services, we have never taken balancing the budget as our primary objective. So for the way forward, we will continue to set up such services in districts where most of these grassroots live, and we will be setting up more integrated health centers in different districts. And also in our social service units, we will arrange for Chinese medicine and dental services to be provided, and the number of places would also go up. So that's the intention. Thank you. All right, before we move on to the next item, I'd like to seek members' views. Do we need to have a deputy chairman? Because just now, after electing the chairman, we seem to have stopped there. So I don't think there is a need, says Ms. Emily Lau. And we also have a few papers which have been tabled. We have our legal advisor's letter, and also the response from the administration. So our legal advisor has written to the administration, and now they have given us a reply. Do we need to ask the legal advisor to brief us on what the letter is about, and also the administration's response? Yes, thank you, Chairman. Earlier on, we wrote to the administration concerning the resolution of the Board of Directors of the Leung Kuk, and we asked the administration to clarify a few points, and the paper number is CB-21085-04. And the administration has already given a response, and the paper number is CB-21085-05. Chairman, basically there are 2 points, because according to our understanding, the purpose of the amendment is under Cap 1040 in the schedule of the Leung Kuk Ordinance. In terms of the purpose, we have inserted the new words so that Leung Kuk will be allowed to provide different medical and health services to the community in Hong Kong, and is allowed to establish, maintain, and manage medical and health care institutions in Hong Kong. And in para 3 of the electoral brief, it says that Leung Kuk has been providing medical and health services for the users of its social service units. And therefore, the first point that we clarify with the administration is that before the amendment, what Leung Kuk has been doing in terms of the provision of such services under the ordinance, which provisions empowered it to do so. And also in para 5 of the electoral brief, it also says that with regard to the fee charging scheme of Leung Kuk, what is it all about? Because it says that Leung Kuk will be providing this at low cost without cross-subsidizing it from other areas. So with regard to this, there is no specific provision as to what or how they're going to charge the users. So under the existing legislation, will Poland Coke be allowed to provide its services on commercial basis? So we would like the administration to respond to these 2 points. Well, the administration has already given its reply. So can we invite the administration to brief us on its reply? Yes, I'll be talking about the reply. Well, the first point is about the existing medical and health services, and under para 1G of the Poland Coke Ordinance, the objects of Poland Coke, it can provide all kinds of social services for the Hong Kong community. And then under para 2O, it says that the Poland Coke has the power to do all such other lawful things as are incidental or conducive to the attainment of the above objects, but then there is no definition of the word or the term social services. And for the existing medical and health services being provided by Poland Coke, they are just supplementary in order to assist Poland Coke to provide effective social services to the users in need. And therefore, the existing services are just limited, and they are only provided to certain specified groups. And in order to ensure that Poland Coke will be able to achieve its object of providing comprehensive social services to the needed, that would also fall under the relevant paragraph. And also with regard to the medical and health services provided by the PLK, is mainly to provide services to the disadvantaged, and therefore it will not be operated on commercial basis. And if you look at the object of the PLK, as we just said, under para 2O, the PLK can undertake anything that would assist it in attaining the above objects, and there is no mention of the fees and charges, and it just sets out the objects. That's why we have now included that. So if you look at the draft of the resolution, it's the same as what it says in the current provision. It just sets out the objects. So once again, we'd like to stress that PLK is one of the charitable institutions which are exempt from tax under Section 88 of the Inland Revenue Ordinance, and the details of the charging of fees are also set out in detail in Annex B of the LegCo brief. So PLK will be charging low cost, and the services will not be run on a commercial basis. All right. Any questions from members? Mr. Christopher Jung. Yes, Chairman. I'd like to ask questions in this regard too. Yes, of course, we support the PLK in providing medical and health services, but then in terms of the law, I think the administration has a lot of flexibility. If that is the case, then why bother to change the law? Because if you're allowed to do anything that is conducive to the community, then why bother to change the law at all? Obviously, you must have omitted something in the law. You would allow it to do so, and obviously there would also be some commercial elements. For example, for the expensive items, you would also be charging people in order to recover the cost, and you find it problematic. That's why you're proposing to change the law. Initially, when you allow the PLK to do it, well, so for amendment of this nature, it's not going to be controversial at all. So how can you say that, well, they are charging people already? So the inference or the implication would be very far-reaching. So apparently you will be allowing it to run its services on a commercial basis, and the public will be concerned that they might be charged in the future, or the fees and charges might go up, because in the past they would be doing this on a charitable basis, and no fees and charges were being imposed. So have you omitted something in the law, and as a result you are going to change the law in order to allow the PLK in the future to impose high fees and charges in the future?
Administration, care to respond? Since the membership is not too large, I will not impose any speaking time limit. Okay, administration. The purpose of the resolution is to allow PLK PLK to expand its services for its ordinary service users to the general public. It's not that this amendment will change its charging policy. And in the dialectical brief, it is already undertaken by the PLK that they're going to serve the underprivileged at low cost. They're not going to run on commercial principles. Mr. Chen, yes, our intention is to help the grassroots because there is a great demand for cheap yet reliable medical services. So for our OPD units, we only charge $45 per visit, including 3 days of medication. For those who are over 65 years old, those receiving CSSA, low-income earners, and DA receivers, we offer services free of charge. For your information, in the past year and in the coming year, we plan to subsidize our integrated health center with $2.5 to $2.6 million at the cost of Leung Kuk. So it's never our intention to offer services at balancing the book basis. Yes, we understand this, but I'm a bit worried. Now, if the amendment is passed, will you offer high cost? Now, let's set aside high expensive. I'm talking about low cost hospitalization and treatment services for cancer, for instance. Do you plan to do this? If yes, will you ensure that you will keep the costs low? Because the community has supported PLK for over a century, and we do support you when you have fundraising activities and flag selling activities. Because if you offer high-cost services in the future, we may lose confidence in you. So will you offer high-cost hospitalization and treatment services in the future? If yes, will you ensure that members of the public can get such services at a low charge? Thank you, Mr. Chong, and thank you for your support. Yes, as we further expand our medical services, we will consider our financial and manpower resources and our capacity. Now we are providing very basic services, mainly outpatient services, general outpatient services. We will not offer surgical services to our service recipients. So we will develop our business in accordance with our capacity. Our short and medium plan is to identify premises in the community to provide general outpatient services. We'll be providing basic primary care to the community. As we have accumulated more experience in the provision of medical and healthcare services, when our colleagues are more experienced, will we develop high-cost services as mentioned by Mr. Chong, or even hospital service as well. We have no intention to do so for the time being. Thank you. Ms. Emily Lau. Thank you. So the administration is not able to fully provide the services, basic services required by the public. I was at PWSC meeting just now, and the Yan Chai and Kwai Ching has asked for a subsidy of $100 million from the government to provide dental services for the elderly. Now, the services planned by PLK are very basic services, and therefore I think we need to establish a subcommittee. Well, there is no basic definition for social services, and as mentioned by the legal advisor, these services are already being provided by PLK, and why is there the need to amend the law? And the reply is they've been providing such services to specified groups of service recipients. Now they would like to extend the service to the general public. Now, if that's the case, shouldn't there be a proper definition of social services and how they will be offered to the general public? Please amend the law. I don't think you require a major operation to the ordinance to do this. Regarding the charging of fees, I thank the legal advisor for raising this. Now, since you have the objective and also the policy, why don't you put it down? We are very afraid of such cliches. So, PLK, do mind mentioning in your schedule or in the ordinance, whatever, regarding your fee charging policies, so that there won't be any disputes in the future. And the administration should make clear this point. Now, the PLK is going to provide medical and healthcare services. This cannot be undertaken by a layman, and that's why even the Kwai-chung District Council is cooperating with Yan Chai Hospital. So, will you ensure that the existing regulators will be able to regulate or monitor the services being provided by PLK? Can the administration have a go first? Or rather, can PLK reply first? Thank you, Ms. Lau, for your comments. As regards how we can make the resolution even clearer and how we can set out the charging principle in the ordinance, where we maintain an open mind. After the meeting, we can discuss with the administration, including colleagues from the DOJ, to see how we can do it. And we will also make reference with other similar legislation. After all, we're going to provide subsidized services. Perhaps other charitable organizations have something in their relevant legislation for us to learn from. Administration. Yes. Yes, Ms. Lau is concerned whether their medical and healthcare services are subject to any regulation or monitoring. Well, medical and healthcare services being provided and to be provided by PLK will be regulated by the relevant legislation. There is no change to that. And they are being regulated by relevant legislation. Chairman, I thank PLK for being so open-minded. So please discuss with the administration, and if our legal advisor has any input, please let PLK have it so as to fine-tune and improve the legislation to make things clear. And I think they're already doing or providing such medical and healthcare services. Why wasn't the resolution introduced earlier? Is it because of the size of the service recipients? Well, in the past, they were only providing ancillary and supportive services in the form of social services. In future, they're going to expand that so that the general public will be able to use their services. So we want to make it clear to avoid possible disputes. Well, maybe there are already disputes now. I don't quite understand what's meant by ancillary in nature. Legal advisor may want to help us to understand. So what are the differences between a service being offered now and services to be offered in the future? Well, we provide users of our social service units, or because it's always our mission to provide a whole person care to our service users. So we offer medical and healthcare services for users of our social service units. So how it would be different from future services? Well, I think the professionals may not be able to answer questions from laymen like us. No. Why do we have to amend the legislation? Well, Leung Kuk has got hundreds of kids in our homes. In the past, there were orphans, and now there are also kids not living with their families. And we have clinics on a regular basis. Doctors come to our hostels to provide medical consultation to our kids. So these are services targeted at users of our social service units. However, elderly members of the public cannot have access to such services. And we also have elderly homes. The elders are frail and sick and bedbound. So we have the responsibility to arrange for doctors to have walk rounds there and provide treatment and consultation to the elders there. Again, such services are not open to the public. They are just for users of our social service units, namely our orphanages and our elderly homes. So only such users can use our medical and healthcare services. We also have elderly daycare centers, daytime activity centers. These elders are healthy and they are mobile. They can come to our activities during the day. However, from time to time, they may fall sick. So we have Chinese medical services and general outpatient services for them. Well, since we have been operating like this for so many years, we do have the basic medical and healthcare expertise. Now, there are many elderly persons in the community, and they have two basic needs. First, the need for medical and healthcare services. Second, if they are better educated in healthcare matters, they may stay healthier. So this is our direction. It's never our intention to operate a hospital. The Dongwon Group of hospitals have been operating hospitals for over 140 years, and for us, we have never run any hospitals, so we have no intention to do so. And we have some financial strength, and there is also the goodwill of PLK. Elders do trust us, so we are thinking of providing general outpatient services to help the grassroots. Now, if they're suffering from major illnesses such as cancer, we can only advise them to visit specialist outpatient clinics of the government. And we don't even know when we can start the planned services yet, because it is a long-term development. We don't know whether a few decades down the road we will have further developments. Anyway, this is our thinking for the time being. And the legal advisor referred to commercial services. Now, this is our position. What is the purpose of commercial operations? Of course, to make profits, to be shared among shareholders. But we certainly have no such thinking, because PLK cannot share any profit, so it is not our intention to make profits. So it's an entirely different matter. PLK has the spirit to contribute to the welfare of the general public. We want to serve them, so we are not going to operate any commercial services. Perhaps members are thinking, I think members are advising us from the perspective of general administration and management. However, we have never considered running any commercial activities because we never have any money to share among shareholders. We have to make donations. So how are we going to run any commercial activities? I thank Dr. Zhang, Chairman, for his explanation. So I don't think we have any major difference in view. And Mr. Chen, the CEO, has also promised to discuss with the administration and the DOJ as to how the ordinance can be better drafted. For instance, should there be any definition of social services?
So, how are you able to translate what the chairman just said into the law so that under the existing mechanism you'll be able to regulate that, and in the future if they are going to provide more, then you will have to make sure that the law will be able to cover that. And what our legal advisor was saying is that well, there were no details about the fee charging mechanism. Well, all you need to do is to include that if that's your principle, so that in the future there will be no dispute whatsoever about this. So if there are any requests from members, please do take it up after the meeting, and then make sure that in your amendment you'll be able to set out everything more detailed and comprehensively. We welcome the Leung Kuk in doing this, but then, as you said, you have some existing services, and you also promised that in undertaking the new services, existing services will not be affected, and you would also not be asking the administration for new money. So I think all of these will have to set out in the law very clearly, so that in the future, for any service users who might be affected in the future, you will have to refer them to the law. Well, some of these might not be possible to be written in the law, but then we will be taking this up next time. Priscilla Leung, thank you, Chairman. 2 meetings are running in tandem. That's why I was there. I'm sure Leung Kuk's work has been widely recognized by the community. And today's amendment is generally supported by members. All we are trying to do is to make sure that it's done better. I have a couple of points. As the chairman just said, you also provide Chinese medical services when you provide these services for free. And in the community, I've heard from many people, in particular the elders and those who need Chinese medical services, in particular those who need acupuncture services, they are saying that only the well-off people can afford to go to see a Western doctor. For example, for some social institutions, they are offering such services ranging from $60 to $1,000 a time or per visit. So for these basic services, if you're able to provide such services to the community, I think it's good, because I think that's also in line with your objects, right? And second, you also talk about running your services on commercial basis. Well, given the fact that you are a charitable institution, even if you manage to make a profit, well, you're not going to use it for your own purposes. You're only going to channel the additional resources to other services. But then it's not like people doing a business. So I think it's better if you can set out everything more clearly in the law, so there would be no misunderstanding whatsoever. But then under 16 and 27, with regard to your proposed amendment concerning some wording, I'd like the legal advisor and the administration to help me. Well, I'm not entirely comfortable when you use the words any kinds. So there should be more qualification to the words, because you talk about maintain, manage, operate, regulate, and supervise. the institutions of any of the kinds. I'm not entirely comfortable with the word any of the kinds. I think using these words in the law might be too broad. So that's my personal opinion. Please do go back and think about it. I agree that they also talk about registration and whether or not that would be linked with tertiary institutions. All right, you also talk about Chinese medicine, and several universities are also running Chinese medicine courses. So can you talk to them? And there can also be Chinese medical practitioners graduating from these institutions who could join your Kuk in providing the services. So I think that would also offer some form of safeguard to your organization if you can indeed get more assistance from these institutions. Well, on the point of law drafting, well, this morning we also have a proposed amendment on the schedule, and if you can refer to para 16, there will be an amendment towards the end of the sentence. So maintain, manage, operate, regulate, and supervise the institutions of any of the kind set out in para 1 that are under the control of the corporation. So for the words any of the kinds or institutions of any of the kinds, they will be subject to para 1. Similarly, para 27, in fact the amendment is consistent with that under para 16. So institutions of any of the kinds are subject to para 1. Will you also set that out? Because so can you qualify that with the objects of the Kuk? They've already set it out. Institutions of any of the kinds set out in para 1 that are under the control of the corporation. So you can also refer to the marked up copy, the last point. They've already set that out. Okay. Anything else? Not? None? I'd also like to ask some questions, but then most of them have been clarified by the chairman already. You said that you intend to provide in-house services, so you are mainly looking at your homes and the uses of your homes, and you are also trying to provide the services to those outside your homes, in other words, the general public. So for people using your medical and health services, what is the size of your team of healthcare professionals? And after this is passed, do you have any plans to increase the size of your team? Well, I personally support that, because in the future we do have this need, and if some institutions are willing to provide such services, of course that's good, so long as you can ensure that the object of the institution can be kept and there will be quality assurance of the services to be provided. Yes. Well, for our health center we have 3 doctors, and one of them are full-time. One of them is full-time, and for the other 2, they are working on part-time basis. We are also in the process of recruiting 1 more full-time doctor, so that that would also help enhance our medical staff's contingent. And we also have registered nurse, and also dispensers, and also clinic assistant to help the day-to-day operation. So in the short term, do you have any plans to expand your district-based outpatient clinics? Do you have any such plans? We are in the process of looking out for an appropriate location, because we would like to identify sites and locations with more grassroots, and they should also be close to our own service units, in particular the elderly service units, so that that would provide greater convenience to them. So we are in the process of looking out for such a site. So our doctors would also provide services at these homes, and we are trying to look for a location where other grassroots would also find it convenient to get our services. Yes, Mr. Ip Kin Yuen. Chairman, I support the work of Leung Kuk. I think it's for all to see. In particular, for those of us from the education sector, the Leung Kuk has been doing a remarkable job in terms of its education services. It's been running schools, and the quality of such schools have been very good. Here, I'd like to talk about the fees and charges, because as far as schools are concerned, most of Leung Kuk's schools are for grassroots students, and most of them are subvented schools, but then some of them are also charging high tuition fees. And of course, we think it's okay so long as most of your schools are serving the grassroots, and it's okay for you to provide some alternative services. But then when it comes to medical and health services, as a start, we would expect that you would mainly be serving the grassroots. That's why, as Ms. Emily Lau was talking about the fee charging mechanism, I would also support that more details be set out in the resolution. Maybe I could also digress a little bit. Well, to the north of Shenzhen River, you should also set up schools for Hong Kong children. I think it's better if you can run those schools rather than relying on the administration to run those schools. And also, coming back to the medical and health services to be provided by Leung Kuk, apparently you just allow it to develop naturally. So have you ever considered this? That is, will you be looking at the overall supply and demand situation in medical and health services? Have you ever made any assessment on that, or have you never done that before? So can you share your view with us? And also, what's the administration's negotiation or discussion with the Leung Kuk on this? So do you have any general medical or healthcare policy? Yes, Ms. Chair. We have consulted the Food and Health Bureau on this, and in principle, the FHB supports this because, well, we have a system where the public and the private sector would work hand in hand, and with the increase in demand, the FHB welcomes the private sector in providing more medical and health services in order to meet the community's needs. And that would also enable the public to have better quality healthcare services, and they will have more choices. That's why the FHB is very supportive of this. But then for the details, well, if their medical and health services are provided, as we have stressed time and again, that they will have to comply with all existing legislation's requirements. Mr. Abraham Sheikh, Chairman, I support the amendment to the resolution so that they can provide more medical and health services. But then I agree with what Priscilla Leung just said. All right, the purpose is to provide medical services, but then in your schedule, you have put it in such a broad term. All you need to do is to look at 27.1 and also 3 and 4 in the schedule. Well, you talk about institutions of any kind set out in para 1. So apparently you can do anything, whatever you want. So you're almost like the Tonghua Group of hospitals, but then at present you are only providing very limited medical and health services. But then if you are putting it in such broad terms, then in the future you can do whatever you like. Yes, Section 88 of the IRO might have allowed you to provide non-profit making services, but then the fact that you have put it in such a broad sense, I do not find any justification to allow you to do that. So by introducing this broadly termed resolution, I am not entirely comfortable with that. So, administration, your response, please. Ms. Wu, Chairman.
The current amendments can be divided into two parts. First, amendment to our objects. That's in para 1. And it will be set out in the objects that they can provide, or PLK can provide medical and healthcare services. And we have also got amendments to para 16 and para 27. Para 16, the heading is Board to Manage Cooperation. So the board has to monitor or manage PLK. So before the amendment, there is no mention of medical and healthcare services. So prior to the amendment, the board shall manage orphanages, schools, and other institutions or nurseries, homes. The amendment to para 1 to allow PLK to run medical and healthcare services, the board will need the power to monitor how PLK operate these institutions. Yes. However, in para 16 and 27, now I will use the English version.
Other institutions 你仲係現有㗎啦，咁你 substitute manage, maintain, manage, operate, regulate, supervise institution of the kind set up in paragraph 1嗰度啦，咁然後你喺第 repeal 咗佢咧，咁你用個repeal 第4 schedule 4。
And you also repeal schedule for 27(1). Any kind of institutions. I think the law can't be so wide, the scope can't be so wide. You should specify the type of institutions there. All right, we won't object to your proposed amendments, but if you allow you to widen the scope to such an extent, now if you want to operate hospitals, this is still within medical and healthcare services, that is okay. But there is someone in the board, or the board must be able to manage PLK in the operation of such institutions. So I think Dr. Priscilla Leung was correct in pointing that out. However, this ordinance has been in existence for a long time. No, I don't challenge that. I am only saying that this amendment would make the scope too wide, and I tend to agree with Priscilla that this is too wide. Only about adding medical and healthcare institutions, yes, but para 16 and 27 will allow it to do many other things in the future. Why can't they narrow down the amendment to these two paragraphs? But I think they will be bound by 1AG. A to G, yes. Para 1A to G. I have no objection to that. I just want the scopes to be drafted narrower. Legal advisor. No, if I'm wrong, the administration can supplement. Let me try to clarify. My understanding is the amendments to para 16 and 27 has changed the current drafting style. If we look at the marked up copy, para 16 deletes different types of Now, currently, para 16 lists out all the different institutions such as homes, nurseries, homes, and other institutions. I think the new drafting style is to define these institutions as institutions of any kind set out in para 1 under the control of the corporation. Yes, the institutions in mentioned in para 16 and 27 will have to be those that comply with the objects. All right, although para 27 says any kind or any institutions, this may look wide. Still, this is subject to the control of objects in para 1. So if we look at it together with all the relevant institutions listed out in the first paragraph, and I don't think the institutions mentioned in para 16 and 27 are really as wide as worried by members. I want the two paragraphs to be amended to the extent that we only add institutions that they are going to add. The law can be construed very narrowly or as well as very widely. So why don't you just add what you want in the future in para 16 and 7 and 27? Do not use do not draft it so that the scope is too wide. So you want it to supervise and manage the homes, nurseries, schools, and medical and healthcare institutions under the control of the corporation. Is that what you mean? Yes. Because the way they amend the two paragraphs will require us to cross-reference back to para 1. I think they're asking for the provision of medical and healthcare services, so we give them what they want. They want to manage health and medical and healthcare services, so we give them what they want. I think your intention is clear. Administration, do you have any response? Well, both Priscilla and I have a common concern. We discuss with the lawyer of PLK and also the DFJ and give you a written reply. Thank you. Mr. Wong Ting Kwang, let me declare interest. I've been appointed by the council to sit on the board of PLK. I'm late because I was at a breakfast meeting at government headquarters. So was breakfast nice? No, the intention was to listen, not to eat. I think this is not about whether the scope is wide or not. It's rather this is about the drafting style of the ordinance. If we have agreed in principle that PLK can expand its services to cover medical and healthcare services, and that is beneficial to the community, I think it is good. I think the new style, the new drafting style is more concise, and I prefer that because the institutions, the kind of institutions would be subject to the objects in para 1. I hope Priscilla and Mr. Sheck can reconsider this point. I don't think there is the question of widening the scope. We, in discussing this bill, we are talking about allowing to expand the service to cover medical and health care. All right. Do you need the administration to respond? Well, the administration has promised to study this issue. I think we might be a bit head-splitting in this process, although I don't really want to use this term. All right. Any more members in the second round? Christopher Jong, Emily Lau, Abraham Sheikh. Anyone more? No? If we do not have any other policy concerns, we can go into the clause-by-clause scrutiny. Well, if they introduce CSAs, then do we have to do the clause-by-clause again? Mr. Christopher Jong, I don't mind as far as the amendments are concerned. For para 16, we can either cross-reference back to the first paragraph or move the whole of DA, or to copy one DA to para 6. Now, medical and healthcare services or institutions can be a big hospital. So I was a bit concerned as well. If we want to do it properly, we can reproduce one DA in the amendment to para 16. So you don't need any response from the administration? Emily. I support Mr. Abraham Sheikh and Dr. Priscilla Leung, and I don't think we're asking too much. So the administration, please discuss with PLK just to make it clearer as far as possible. And I don't think members are opposing your amendment, so please think about this. And I also agree with Mr. Yip. Perhaps the administration should give us a paper to tell us how PLK is echoing the administration's general policy, and please give us a paper on your future plans. For instance, members have asked how much extra manpower you will have and what facilities will you offer. When you have something more concrete, please let us know. And your paper should state clearly how the administration is going to monitor or regulate their services. Dr. Zhang said they are not going to build hospitals, but they will offer outpatient clinics. Now, the way it is drafted here, they're not allowed to build hospitals. And legal advisor, please help us to vet the provisions very carefully when it comes to the regulation of the new services by the administration. Should the text be clearly written so that there can be proper regulation of their future services? So please give us an information paper after this meeting. Mr. Abraham Sheikh. It's not that I differ from Mr. Wong Ting Kwong or Mr. Christopher Jong. From the perspective of law drafting, I just want the schedule to be clearer. PLK has done a lot of good things to serve the community. It's not that I don't trust PLK. I just want the law to be clearer. I hope the administration can revisit the drafting. The purpose not to disallow PLK to do this or that. Rather, it is to allow PLK to do it with an easy mind, without fear of criticism in the future. Now, if you can do what has been discussed in this subcommittee, is perfectly fine. I'd like to express my views on the amendment as well. I hope that after the amendment, we can give very clear boundaries for the operation of PLK, and we should encourage such an excellent charitable organization to do even better. If Leung Kuk feels competent in running a hospital, you have my support. Because even though the amendments are passed, the administration has a series of measures to regulate PLK. So long as PLK thinks that it has the capability and the resources and is in line with the government's policy, I have every support for PLK is going to do. Personally, I think the current drafting is perfectly fine, but in the light of members' concerns, perhaps members can discuss with PLK to see how the concerns can be addressed by amending the resolution. Well, the resolution itself is not very complicated. There are only 3 big areas. If members have no problem, we can go into a clause-by-clause scrutiny to see whether we have new concerns. If none, we will, or if yes, we will group them together and ask the administration to consider CSAs in one go. Then we'll be able to save time. Still, we may not be able to meet the deadline because this is the deadline. Today is the deadline for giving notice of amendment, and it has to be passed by LegCo on the 26th.
Mr. Abraham Sheikh, Chairman, I'm not trying to stand in their way. In particular, they'd like to roll out the new services on the 1st of June. So I think I am prepared to support their current amendment. But then if we might delay the implementation of the whole thing, that might not be good either. So I've already stated my views. And if you're happy with the current approach, then I would be prepared to agree to it. But then I was just stating my personal views because that's my responsibility. But then I'm not insisting on doing it in accordance with my suggestion. Ms. Emily Lau, I'm somewhat more insistent, and I'm pleased to hear from the chairman of the Leung Kuk, who said that he would be prepared to think about it, and it's also very reasonable. I hope that you can take it up with the administration and see how that could be done. I think that would be more reasonable. I've also talked about the details of the fee charging scheme. Please think about it. Can you make it clearer in the law? So are you trying to ask us not to insist on that? I don't quite understand why you are insisting on that, because I'm not a lawmaker, and I've been here listening to what was said just now. Apparently, you all appreciated the work done by the Leung Kuk, and you would all like to see this charitable organization help the disadvantaged groups in Hong Kong. And after hearing from what you said, apparently you were suggesting that there should be more regulation on the services and also the fee charging mechanism. Well, let me say this at a personal level. Yes, we have all the colleagues here from Leung Kuk working, and our board is responsible for monitoring their work, and apparently the LegCo is now trying to supervise our work. So it's a multi-layer approach. But then for a particular individual or an institution, what can he do to survive? And as far as Leung Kuk is concerned, it's a brand name, and it is not making any profit at all in providing services to the community. And I'm sure the board in the future would also insist on this branding, and it would also insist on this quality. So it would be doing this for charitable purposes, and if the community has any bad impression about this institution, and if members of the public do not donate money to it, then it will no longer be able to survive. It cannot afford to do it, or it cannot afford to allow that to happen. So it will have to insist on its objects before it can get the support of the community. So probably you might not have been able to understand it. Indeed, if the fees are very high, and if everybody thinks that it's not reasonable, and if they think that we are not serving the community at all, then Leung Kuk will definitely have to go bust. So we have more than 100 years of history, and definitely that's not what we've been doing. And the spirit of Leung Kuk has been that we have insisted on serving the community. That's why we have earned our reputation like that. So I hope that you can give it more thoughts. So maybe I'm inviting you to think about it from this perspective. I personally believe that it would not go astray, so to speak, and also the fact that we have this advisory board monitoring the performance of the Coke. The HAB is also monitoring its work. And also we have this advisory board, and we also have former chairman sitting on the advisory board, and also we have some lawmakers or former lawmakers sitting on this. All right, we have the board monitoring the work of the Coke staff, and then the advisory board is monitoring the board, and then the community at large is monitoring the general work of the Coke. So that's how it works. And would it make mistakes? Yes, from time to time, we might have omitted certain things, and that would also require some adjustment. But then, given the fact that we have already got this multiple layer of supervision in the past, if it made mistakes, it would make adjustments, and I'm sure that would be the same in the future. I think colleagues have already expressed their concerns, and I hope that the administration can come up with a written response, and it could also work that out with the Bureau, so that you can set out all your views in the paper, and that would also be kept as records. As regards whether or not the wording can be changed, I hope that the administration can consider it. Ms. Emily Lau, I agree with what you said. I found it strange why Mr. Chang would change his stance in an hour's time. Initially, he was very open and he was willing to discuss it with the administration. But then after hearing what you said, and Mr. Wong and Mr. Chong and Mr. Shek said that there was no need to change, then he changed his stance. It doesn't matter. People are subject to change, and even in an hour's time, you have changed your mind. But then I hope that you can consider it after the meeting. And of course, if you do not amend it, we can also move our own amendments. But then you don't have to worry. We are not trying to filibuster. Of course, I cannot speak on behalf of other people, but that we all have to be reasonable. I hope that the administration has heard it loud and clear. For people or members in this room and outside the room, we are sharing with you our views. We are not trying to stand in the way of your amending the law. So we are not trying to make things difficult. We are not trying to insert something to make things difficult for you. And some of the concerns have been raised by the legal advisors. So we are suggesting that you go back and think about it. Well, some members say that, all right, you don't have to be bothered. Well, please think about it. Please think twice, Chairman of the Leung Kuk. Yes, Mr. Chang? Well, I'm still open-minded. I haven't changed my stance at all. But then, after taking part in the meeting and after hearing what members said, I just said what I had said just now, but then I have not changed my stance. I've never said that these are unnecessary. Yes, any further questions? If not, then I hope that the administration will give us a written response to all the points made by members. So can I suggest that we go on to clause-by-clause examination, and then depending on what happens next, when necessary, we can have one more meeting. Is that okay? Yes? Then if there are no further questions, then we'll move on to clause-by-clause. The legal advisor has already prepared a markup copy for members' reference. So, legal advisor, can you take us through the clause-by-clause examination? Well, Chairman, we have already prepared a markup copy, and paper number is CB-2-1085-02. And Chairman, well, for the details of the amendment, maybe the administration can walk us through those. Yes, administration. Yes, back to para 1 objects. We hope that we'd like to insert DA so that the objects of the Leung Kuk would enable it to establish, maintain, and manage medical and health care institutions in Hong Kong. We would also like to add this subparagraph FA so that Leung Kuk would be able to provide all kinds of medical and health services, including dental services, for the Hong Kong community. What would this be very broad? as Mr. Chang just said, well, they are not going to build a hospital, but then, Chairman, you're in favor of them building a hospital, right? No, I didn't say that. Well, even if they want to run a hospital, this would allow them to do so. Is that right, administration? Well, so is it that this provision would allow it to run a hospital if it wants to? So, legal advisor, can you also give us your professional advice? Chairman, the administration can supplement if necessary, but then if you look at the words here, well, medical and health services here, they can be as broad as having or setting up a hospital. In fact, the administration, in its legislative brief, it also contains a schedule. It's about the development of Leung Kuk medical and health services, and a lot of details are included there. And there is also a description there. And if you refer to Annex B, with regard to the long-term objective, it is premature to set specific time frame to set up private hospital, and apparently they have no plan for the time being. But then if you look at the wording of the amendment, they are talking about medical and health care institutions, and in the long run, in the event that Leung Kuk would like to set up a hospital, and of course, as the administration just said, there are other pieces of legislation that they will have to comply with. For example, if you want to run a hospital, then there are many legal requirements, and in the lease conditions, you also have to comply with those lease conditions. So many of these might not have been set up very clearly in this, but then when it comes to the objects of the Kuk, well, it's very broadly termed to such an extent that even hospitals can be included. Is it the intention? Thank you, legal advisor, for your interpretation of this version. I also agree with what you said just now. But then I'd like to ask Ms. Emily Lau, well, even if Leung Kuk's vision is that it's going to run a hospital under its medical and health services vision, then what's wrong with that? You should not have put it to Ms. Emily Lau. You should have put it to the Leung Kuk. What Ms. Lau is concerned that it might be running a hospital. So in your view, well, apparently running a hospital is not a problem at all, because it's also part of serving the community. So I'd like to know why Ms. Lau is concerned. So if Leung Kuk is going to set up a hospital in order to serve the community, so what kind of bad implications will there be? Well, all you need to do is to express your personal views. Whether you think it's problematic it doesn't really matter. Well, in my view, anything that is good to the community is good. So I would not be bothered by that. Well, the legal advisor has already set out his interpretation. Is that right? Yes, we agree with the legal advisor's interpretation. There are several points that we'd like to emphasize. Number one, with regard to this resolution, in fact, is in line with the government's policy. That is, we welcome the private and non-government sector in developing and providing more healthcare-related services. And of course, Leung Kuk at present has no plan to set up a hospital. But then in the future, in the event of any future development, we have no idea as to how far it might go, and I'm sure it would look at the community's needs and also the resources available to the Kuk. What's most important is whatever medical and health services are to be provided by the Kuk, they will have to comply with all existing legislation, including the legislation regulating hospitals, clinics, and so on and so forth. So the most important thing is to set up what you want to do, and also the regulatory framework will have to be there in the law so that there would not be any omissions or problems. In fact, I have no qualms about that at all. So even if you're not allowing me to respond to Mr. Wong Ting Kwong, I am okay. I'm prepared to respond to that. So you will have to set out everything in detail in the law instead of trying to do it by plugging or by taking advantage of the loopholes. So all I'm asking is, will that be included? And then for the regulatory framework, the legal advisor will have to assist us in ensuring that everything is done properly. So I'm just applying that logic. All right. Any questions on the first paragraph on objects? Well, they also said that medical and health services, and then they also including dental services. That's put in the brackets. That's very strange because there are different types of medical and health services. Why do you have to specifically mention dental services? Are other services not included?
Missy or Mr. Wu? We have consulted the Civil Law Division of the DOJ in the process of drafting. Well, there are different definitions. There are definitions for different types of medical and healthcare services. We understand the PLK would like to offer dental service in particular, among others, to avoid confusion as to whether this is allowed. We have deliberately added dental services in the drafting to avoid confusion. Well, this is a big issue. Now, if you have included dental services here, then what about services not included here? They will not be allowed in the future. So Dr. Zhang want to expand to other services, they have to come back and amend the legislation again. What kind of advice is this? Now here, Mr. Wong, I want to help PLK. Yes, I know. You also wanted to help them. Please speak only when I invite you to. Yes, I appreciate Ms. Amber Lau's issue. And regarding this one, I also share Ms. Amber Lau's view. I'd like to ask the DOJ, what about other related medical and healthcare legislation? Do we really have to single out dental services here? Is it always the case that dental services are singled out in other medical and healthcare related legislation? Ms. Wu. We can provide a detailed written reply later. In fact, the regulation of medical and healthcare services and vis-a-vis dental services are different. So our Civil Law Division is of the view that it would be clearer if dental services are singled out and included here. I just want to give PLK more flexibility. Now, if you include dental services here, does that mean that they're not allowed to provide other services in the future? You have to consult your legal advisor, clearly. Our own legal advisor. Whereas the administration said they're going to give us a more detailed reply. But from the perspective of law drafting, perhaps I can give some comments. Now, if we look at 1FA, it says to provide all kinds of medical and healthcare services, including dental services. So the drafting style is to include a certain kind of services. I think the intention is for the avoidance of doubt. This is about whether medical and health services should include dental services. For the avoidance of doubt, perhaps in some other pieces of legislation, medical and healthcare services are separated from dental services, and they would like to include here specifically. However, Ms. Emily Lau's concern is, as a result of this inclusion, will you be excluding other services? From a law interpretation point of view, I think we still have to consider the general interpretation of medical and healthcare services. What do they include in general? I think usually the interpretation of this phrase will be confined to a certain extent by what is included in the bracket that follows. Well, these are my comments. For the time being, we await a reply from the administration. I think the legal advisor has pointed out the system in our society. Our medical and healthcare services do not provide dental services, and therefore elders, they don't have free dental care services, and well, they have to wait for a long time, and even civil servants complain that they have to wait for a long time. Well, hundreds of thousands of people will queue up outside your clinics, PLK, in the future, waiting for dental services. This is very clear. No, Chairman, they should clarify in a paper. Well, although this may not be a directly relevant point, but I want the administration to specify or to give us an explanation. It's strange that in many hospitals there are no dental clinics. Well, in CGO on the 7th floor, there is a dental clinic. You may say that this is a historical. There is a historical reason. So why do we have to include specifically dental services here? I've been a legislator for more than 10 years, and I'm still rather confused when it comes to this. The Medical Council is a disciplinary body or regulatory body for medical doctors and not dentists. Is that right? Because dentists are separated, and as a result, in PLK's amendment, they have to include a bracket to say including dental services. Anyone from the administration? What about chiropractors? Do they have to be listed here? I don't find, but I think the Medical Council is not the governing body of chiropractors. Does the Medical Council regulate or govern dentists as well? This affect, the wording here affect our amendment? No. Well, I think Ms. Emily Lau has stated very clearly that legislators here support PLK's move. The question is, since we have set up a subcommittee, we have to understand the details. So we may delay the passage of the resolution a little bit. I think it is already very clear. The administration has to provide a response with regard to the wording here. Mr. Yip, are you on the same point? Well, it's related to the resolution, but not related to this point. I think DA and FA are repetitive. Why do we need two here? For instance, E says to establish and maintain and manage schools. You don't need another one to say to provide all kinds of educational services. So why do we need FA after DA? Administration. Thank you. In the please refer to the various provisions under para 1. The drafting of DA is to echo D, to establish, maintain, and manage homes and nurseries. So the focus is to establish, maintain, and manage such institutions. And FA echoes a G, to provide all kinds of social services for Hong Kong community. So this is to point out that one of its objects is to provide all kinds of medical and healthcare services, including dental services for the Hong Kong community. Speaker is off mic. Because this is different from education services. Well, they can purchase such activities from PLK. Well, if you don't see any problem, there's no need for you to give comments. All right, do we have any other questions on this paragraph? If not, so the administration is going to review the point about whether dental services should be included. They're going to give us a written reply, for sure. The second amendment is to para 16, administration. This is about the need for the board to manage the corporation. So the amendment is relevant to para 1. The board had, because of amendments to para 1, para 16 has to be amended. And we've also noted members' views. We're going to provide a written response. Yes, please consider this. Currently, they have a listing approach. They list the homes, nurseries, schools, and other institutions. Perhaps Chairman of the Cook can tell us what other institutions you're referring to. I think there are two schools of thoughts. Some members ask you to give us an exhaustive list of the institutions, and some members think there is no need. Can you tell us what are the other institutions in old para 16? No, what other institutions do you have? All right. There may be schools or registered teaching or education centers. What others are there? Well, they will not be outside the scope of para 1. All right, please consider. Either you list out all the institutions specifically, or you use the current amendment, any institutions. Of course, I think you prefer the latter. Well, we are a layman when it comes to law drafting. In the old paragraph, well, it was drafted when we had those institutions, so we could include the types of institutions here. But in the future, we may have to set up service units or institutions to provide new services. And therefore, we have the term other institutions here. For instance, the CEO mentioned education centers run by the cook, because some children have no parents to look after them after school, because our parents are working. So we are now running education centers, offering tuition services or extracurricular activities. So we have education centers now. But when the law was first drafted, we could not foresee such a social need or social development. So now that we are going to amend the legislation, well, some members said perhaps we are making it too wide. We can adopt the old model. We'll list out what institutions we have and to include other institutions. This will give us flexibility, because Leung Kuk is here to serve the community. When there is such a social need, we want to set up institutions to meet that needs. I think Dr. Zhang's proposal is reasonable, so please consider this. So you are going to add outpatient services. Now, in the old paragraph, it says to supervise and manage. However, in the amendment, you say to maintain, manage, operate, regulate, and supervise. You have added operate, regulate, and supervise. These three words are new. Can you tell us why? Please allow them to answer. Legal advisor, no, ask the administration to explain, because they've added these words. In amending para 16, we've referred to para 27. Please refer to para 27.1 towards the end of the second line for the maintenance, management, operation, regulation, or supervision. We want to align the verbs in para 27 and para 16. So that's why we have added such verbs not currently found in para 16. All right. Because echo 16, para 16 and 27 echoes one another, and you're not asking them to do something new, and you only reproduce what's in para 27. Mr. Christopher Chung.
I think it's rather repetitive of what's set out in para 1, and if you want to include everything in para 1, then you will have to set out everything from A to G, including women's hostels and so on. So para 20, if you want to set it out very clearly in both para 16 and 27, then everything in para 1 will have to be rewritten there, and that would also be difficult to read because, well, para 1 sets out everything from subparagraph A to G. That sets out all the services being provided by the cook, but then it's not possible to repeat everything in other clauses. It would be very cumbersome. So concerning para 16, I think that's very good. So you are prepared to accept that amendment. I don't think that needs any further amendment. Any other questions from other members? If not, then let's move on. So please brief us on the next amendment. 27 is about the power to make regulation. In fact, 27 also echoes 16 because in the end we have changed it because we have changed para 1. So it's a corresponding amendment. Any comments? If there are no further questions, then I think we have completed the clause-by-clause examination. Chairman, well, on fee charging, well, please go back and think about it. Can you make it clearer? Yes, Chairman, you don't have to frown. In fact, that's mainly to put that in writing as to what you are already doing. As the legal advisor said, there is nothing that sets out the existing policy of the cook, and all we are asking is that that be spelled out more clearly. Sorry, speaker is not coming through. Please speak to the microphone. Yes, Dr. Cheng? Well, we cannot say that, all right, we are charging people $45. We cannot spell out that we can only charge people $45, or else we will not be able to increase the fee or reduce the fee. So what are you expecting us to do? What are you asking us to do? All right, Dr. Cheng, I think you've got the letter from the administration before you, right? Para 5, can I refer you to that? Para 5, the last few sentences, says that Leung Kuk has undertaken in its detailed plan that PLK will provide medical and health services at low cost to the general public and for free to the underprivileged, and that's your policy. So do we find it necessary for that to be written into the law? And of course, the chairman also raised a very good point. All right, please do not sell out $45. What if I increase fees in the future? So I'd like to know, because we have no say at all if you want to increase fee in the future. All right, what if you try to increase that from $45 to $75? Then there will be nothing that we can do. Yes, that's the existing policy, but then if it wants to increase fees, then what's the current practice? So who will have a chance to say yes or no to it? Dr. Cheng? Generally speaking. So we are doing this on a charitable basis. We try to serve the community. That's why for staff of the Leung Kuk, we are not staff. So we are the ones who are contributing the money and efforts. So it's the staff who are doing the job. So they would look at the needs of the public and also the community. So in line with this spirit, they will make recommendations, and then the board, in accordance with their recommendation, would consider such suggestion, so that we would be looking at it from the management perspective, how we should be doing or what we should do. All right, let's say if they suggest that we should charge $1 million, and if they propose that we should charge people $100, but then the board would say that no, I think we should only charge them $45. So we can only note their policy, and there is nothing that we can do to affect their decision. So if you can set out your policy in the law, I don't think any electrical member is attempting to influence your fee charging policy. But then the most important thing is to set out your policy in a paper. All right. Of course, you're very happy with the current approach and everything is decided by the board. But then do you also agree that we should set out in greater detail in the law as to your fee charging policy? In particular, this council is very concerned about this. Well, it's difficult for you to set out the details in the law as to what your fee charging policy is. But then if the Cook and the administration can look at the spirit and also the policy of its fee charging policy, if there can be certain illustration in the law, I think that would also be good, because that would also help address some of the concerns of members, and that would also be kept in the records of this council. So, Ms. Lau, would you find that acceptable? No, our legal advisor is asking this from the legal perspective. If it's not possible, then why would he bother to ask us questions, legal advisor? Well, in the end, it's for members and the administration to decide. But then if you look at it from the legal drafting or law drafting perspective, if you want to realize the policy principles in the provisions, then, well, I can come up with this suggestion. You can consider that as a general direction. Is it possible, in order to realize the principle of the fee charging policy, it's not about exactly how much you're charging, 45 or otherwise. So it would be providing medical and health services at low cost or for free to the general public and the underprivileged. So the principle is that you'll be charging low cost or for free. So that would also realize your overriding direction. So that would also give you some flexibility so that you would not have to specify the actual amount to be charged. So that could be one of the directions to be considered. I think that's a very good suggestion. Please consider that. Well, I support the spirit, but then if you put that into the law, that would give rise to more disputes. All right, if people have to pay $300 to go for a visit or to consult a Western doctor, what if they just charge $280? Well, if they charge a very high fee, I would not be donating money to them. I would not be helping them with seeking donation or contribution from members of the public, because, well, if you're charging $300 while a Western doctor in the private sector is only charging $250, then why bother to go to them? So how should it be defined? I don't think we should be regulating that or regulating them with so many regulations. I think they should be subject to the community's watch and supervision. All right, given the fact that they are a charitable organization, and if they try to charge high fees, then I would not help them with raising funds. I don't think that would happen at all. So I think it would be even more problematic if you try to put that into the law. Mr. Wong Teng Kwong, I support what Mr. Christopher Chung just said. Number one, Leung Kuk has more than 100 years history when it comes to serving the community. I think many people in Hong Kong have great confidence in them. They are a good brand name in Hong Kong, and at the EXCO level and at this council's level, we have got members sitting on their board monitoring their work, and in the long run they would also have to rely on the general public's support for their work, whatever they say, whatever they do. And if they have been unfair in serving the community, or if they are not able to meet community's aspirations, then this institution will collapse and they will not be able to make any progress at all. They will not be able to win the support of the community, let alone this council. In fact, they will only attract more criticisms and even punishment. So we are not undermining our own authority or powers, but then we should not be self-important and try to expand our powers all the time. Putting everything into the law when compared to supervising their performance by morals and ethics, I think the latter would be even more effective. Mr. Ip Kin Yun, I think from the perspective of monitoring by law, I think sometimes it's better to put everything in clearer terms in the law. Because when the administration goes about this, sometimes it would involve offering land to them, and there would also be subsidy and subventions and so on. And therefore, correspondingly, if there is a clear regulatory framework in law, then that would be better, instead of putting everything just in faith. If you can do everything just in good faith, then there is no need for us to have any laws at all. But then the thing is whether or not the wording is acceptable. So, well, for different people, they might have different interpretation of charging people at low cost, and therefore Mr. Christopher Chung might have his point there. So, according to what you suggested, can the wording that you propose or similar wording be tenable in law? And if they have similar precedents in the past, then I think we can consider it. That's why I make that as a tentative suggestion, so it's up to members to decide how you're going to work that out in the detailed provisions. And I'm sure the law drafting provision colleagues here, they are very professional and they should know what to do. And I can also give you some examples, because if you look at similar institutions or similar legislation, the Tonghua Group of Hospitals ordinance would be a similar piece of legislation. And for the setup, the organization structure and the provisions, they are quite different. But then I can also cite this for your consideration. In fact, in the schedule of the Tonghua Group of Hospitals Ordinance, they also have this objects clause in para 1, and they also say that, well, when the institution offers free medical services to the community, they set out the names of some hospitals. But then finally, they also said that the board can adjust the fees from time to time. So it's also very broadly termed. The overriding principle is to provide free medical services, but then the board from time to time can also adjust or introduce a fee where necessary. So for similar institutions and similar pieces of legislation, I found this. So the administration might wish to consider it and get back to this subcommittee later. Yes, we are supposed to end by 10:45. We only have about 3 more minutes to go. So are there any further questions from members? If not, then we also have some outstanding issues to deal with. So if we need to have further meetings, then we will have to extend the scrutiny period until next week. And that's something that we will have to put to the vote today. So we will have to indicate, do we agree that we will have to extend the scrutiny period? Yes, says Ms. Lau. And the administration would also have to come up with a written response to all the points that have been made by members. All right, why don't we schedule another meeting, and if there is no need for us to have that meeting, then we can cancel it. Yes, that's what that's what I am about to say. If we need to have another meeting, then we will have to fix the date and time for that. And the secretary has come up with this suggestion. That's the 31st of March from 9 to 10:30, same room. So what do members think? Is that okay? And also, how about the 1st of April? Would that be okay? Well, we have started the special FC. There is no such meeting, no special FC on the 1st because we only start at 2, because on the 31st I have another meeting to go to. So can we try April the 1st because I've not jotted down any meeting here in my diary. And the legal advisor will be following up on the issues that we raised today, so he'll be checking the English version to see if there is any point that he'd like to remind members about, and then we will see what the administration has to say in its response, whether or not there will be further amendments. Secretary, anything else? None? Okay, so much for today's meeting. Thank you. Meeting adjourned.